Welcome to this week's CEO blog. We're here with Dr. Rob Lloyd, who's our full-time radiologist at Pullman Regional Hospital. We're excited about the introduction of 3D tomosynthesis mammography. It's an upgrade from the mammography we've been providing the community, digital service, since we opened the hospital back in 2004. And we expect to be offering this service in May. And so we want to give you an overview of what its benefits are and how we see it serving the community. Dr. Lloyd, what is different about the 3D tomography versus the 2D we've been doing for so many years?
Ooh, that's an interesting question to try and answer in a short period of time. We basically, with the 3D tomography, the images that I get to evaluate the breast health and to see if there are any potential worrisome lesions within it, rather than being a single static two-dimensional image, I get a stack of images, and I'm able to look through the breast kind of a slice at a time, and I can see the structure and architecture of the breast tissue at a much higher level or greater detail, so that we have improved sensitivity for identifying lesions.
Okay. What makes that a benefit for patients?
Different patients get different degrees of benefit out of it. Often we'll discuss breast density. All women have fatty elements in the breast and fibroglandular elements in the breast. Both of those tissue types are normal, but different women have different proportions of those tissue types. A breast that is very fatty is actually very easy to read on even the older two-dimensional technology, because it's a very fatty breast. There's nothing else in there to kind of confuse the picture and make the interpretation of the mammogram difficult. However, a woman that has a higher proportion of the fibroglandular tissue, that fibroglandular tissue, again, it's normal breast tissue. However, it acts sort of like a camouflage. And that camouflage can cause two different problems. As a camouflage, it can hide things that we do need to find. If there's a cancer there, this breast tissue can overlie that and mask that from our detection. The camouflage can also simulate lesions that aren't real. And so women who are going to benefit the most from the 3D mammography are going to be those who have moderate to high breast density. Because instead of having to look through all of those layers of camouflage at one time, we can separate these layers out and focus on one layer at a time, and be able to identify cancers that may have otherwise been missed, and also help us to reduce the number of false positives that we would get and reduce the number of callback letters that we'll have to issue.
Okay, so there's greater assurance that when a patient has a 3D mammography done here at Pullman Regional Hospital, their result will be more reliable. It won't be the possibility of a false positive or something like that.
False positives will still exist, but we'll have, depending on the study that you cite, we'll have anywhere from a 20 to 40% reduction in the number of false positives that are generated. And so false positives will still occur, but it's a significant reduction.
So when do you expect we'll start offering this service for patients?
I'm confident that we will have this service available by May 1st. Basically, what is today, April 14th, and we're going to be actually installing the equipment today. But there's a little bit of a lag time for the physicists to come and do the calibrations and to get the paperwork in the accreditation process for the machine.
Wonderful. Well, there you have it, 3D tomosynthesis at Pullman Regional Hospital. A unique service because the community made it possible through generosity and through their interest in making sure that Pullman Regional Hospital is able to provide the most up-to-date technology for the early detection of breast cancer and breast health in women. So thank you for turning into this blog, and we hope you choose to have a great day.